it safe? Is cannabis safe? What are the side effects? Well, in Dr. Meshulam's study, that last one I showed you, the most common side effects were dizziness, dry mouth, and somnolence. And these reported symptoms occurred in 9, 7, and 4% of patients at least once during that 6-month period. So they got on cannabis therapy. If they reported any episodes of dizziness, they were put into this adverse event profile. So yeah, so it turns out that you can get dizzy or have a dry mouth or feel tired from cannabis. Those are potential side effects. But fortunately, it did not occur in a large number of patients. We don't consider this a large number, 9%. And it's usually tolerable. And well, anyway, we'll get into more of that another time. So talking more about the risks of using cannabis, it can cause intoxication. If you use too much cannabis and you get high or stoned, you can't operate a motor vehicle or do your job. If you use it with opioids and alcohol, it can cause a problem. There is something called cannabis use disorder, which usually occurs in teenagers who use heavily every day, and then they remove themselves from social interactions. They become amotivational, and they don't feel as though they can function without cannabis. That's a cannabis use disorder. Does that happen in older patients with medical problems? Not really. It's basically a psychological dependence, not a physical dependence. And of course, there are medication interactions. For example, Coumadin, warfarin, and cannabis, and fluconazole. There's some other medications that don't quite agree with cannabis, and that has to do with enzymes in the liver. And of course, there are legal aspects that limit cannabis transport and use. And I have a bunch of patients that are interested about their carry permits too. So, nuts and bolts. You come to the office if you're interested. Give us a call, and we will provide education, more education. We will talk with you if you're interested, or you know someone that might benefit from cannabis, for example, for anxiety or insomnia or pain, or epilepsy or Parkinson's or GI issues. You come to the office, you enjoy the experience, that's confidence, right? And then we help you fill out the form. And then within 2 weeks, you get approved by the state, you go to the dispensary, and you get your cannabis medication. And then we continue to guide you with the dosing and proper use, whether or not it's vaping, or which is inhaling the vapor, or using capsules or tinctures. So in general, in conclusion rather, I just want to emphasize that cannabis has been around for a long, long time, and we're still learning so much more about it. I believe, as others do, that cannabis will be the aspirin of the 21st century. Thank you.